morning. Hey guys. Good morning. Happy Tuesday. Good morning. I see some joining in on Instagram. I'm going to give you guys a moment. I hope you're having a great Tuesday. Pig is enjoying her bone. I'm hoping she won't disturb us today. If she does, I will kick her out. Anyone over there on Facebook, please shoot a hello, please, so I know when to dive in. Hey there, Richard. Thank you so much. So, I don't normally talk a lot about the current situation directly. There's many reasons for that. You know, I'm someone who believes that everybody has different viewpoints and everybody deserves to be heard and everybody doesn't have to agree, you know. So I don't usually like to dive into a lot of current events per se. But today I just read an article that really hit home for me and that really I felt needed to be shared. And I had a question yesterday. This actually stemmed from a question I had yesterday, and I'm so sorry I cannot remember your name. Maybe you'll speak up, maybe you're out there, asking about depression. And I know I have talked about depression before in many different ways and how stress impacts the neurological system and how that can impact depression. And I've talked about gut health and depression. And way back in March, I think it was, I did a live on isolation and depression, which I don't know that many of you saw. And I want to circle back to depression in society as we have it right now. I have no doubt that the majority of you have some sort of depression or anxiety going on. I know that I do. I think talking to patients and my clients, the fear, the anxiety, the depression swirling around right now is incredible. So I read an article, it was a study that talked about depression in COVID. And I really want to share some of the stats with you, and I want to have a conversation about it. And I'll warn you, I didn't spend a lot of time laying out my speech today. I'm here as just a friend, a conversationalist here. I want to open up some discussion. I want to talk about what I'm seeing. I want to talk about what you can do. And I want you to know that all of you out there are connected. We are all going through changes in mental status. And so I want to talk a little bit about that today. So I'm a little bit more laid back today. It's a little bit more conversational. I hope you guys don't mind. But I feel that today's topic really hits home, guys. Really hits home. You know, when we think about depression, most of the time, you know, when you're reading about articles about depression, you're thinking, okay, holiday depression, postpartum depression, loss of a loved one depression, you know, those are all valid reasons for somebody to become depressed and very common. But what we now have to add in is pandemic depression, loss of jobs, you know, change of lifestyle, and more importantly, what I'm seeing and what the research is showing is this just breaks my heart, the tremendous increase in suicide from fear of something that our society is being misled all the time. I'm not taking sides. I want to be clear. But I think all of you can agree that there's a lot of conflicting data during this pandemic. There's a lot of conflicted sides. There's a lot of anger. There's a lot of fear. And here's the problem. As a doctor, it scares the living daylights out of me because I'm seeing people go down a rabbit hole into depression and anxiety that absolutely breaks my heart. And I don't know how we can get out of it other than to be here and talk to you and talk about ways that you can reframe the situation. So like I said, this is a more personal topic, but let's kind of dive in and hopefully you guys will run with me here because some of the stats are pretty incredible. I hope you guys can hang around and hear some of this and share it with your loved ones, and hopefully we can make a change and change what's going on out there. Like I said, depression commonly, I've written an article about depression in the holidays, losing most of my family, when the holidays come around, it's really hard on me, because I have these memories and, we talk about that postpartum depression. I remember feeling so overwhelmed after Cameron was born because I couldn't breastfeed him. It just would not work. And I remember just beating myself up and being depressed over it. And, we have these little things that normally impact us. And maybe you guys know this, but normally there are 5 things typically that increase depression in our world. Money is number 1. Number 1 stressor, money, okay? Number 2, work. Number 3, family. Number 4, relationships. And number 5, economic outlook. Those are the 5 things that typically cause depression. Now think about what we're all going through right now and the pandemic. How many of those 5 are impacted all at once? All 5. All at once. Not just one. All 5. Money. How many people are struggling or are uncertain about money? How many people have lost their jobs, their businesses, their lifestyle? How many people have stress in their family, changes in their family? I can tell you anyone with children has. Trying to teach kids at home, trying to figure out how to entertain them when nothing's open, trying to explain to a 9-year-old what's going on in the world right now. Economic outlook. Think about that one. What are we going to do? Right? All 5. And let me tell you, the suicide rates are steadily increasing. Depression is steadily increasing. And yet, most of it is driven by social media and news outlets. What's the pandemic? The virus, obviously, in a small percentage of the population, and I want to be clear on that because we're spending a lot of time talking about the small percentage and not a lot of time talking about over 3 million people who have recovered from this virus and the ongoing updates to treatments. And there are treatments and people are surviving and people are being discharged from hospital and hospitalization rates are steadily dropping. Death rate is continuing to go down. There are a lot of positive advancements that aren't being shared, but we're spending a lot of time in that arena talking about the small percentage, but what is that doing to our stress level? What is that doing to post-traumatic stress for people that have already had COVID and survived? And I have some numbers to tell you what that's doing. Think about it. The fear of catching it. How many of you have that? And did you have that 6 months ago? Did you have that during the measles outbreaks? Did you have that during the flu outbreaks? Did you have that, during Ebola? Did you have that during H1N1? I was in medical school during H1N1 and we had to suit up to see everybody. And I remember I was like, oh crap, well here it goes, like whatever, I'm gonna get it. I didn't. Oh, maybe I did. I don't know. You don't test for it, right? People say, oh, well, everyone has COVID. How many people have had the flu? How many of you actually get a flu test when you have the flu? I don't. I just lay in bed and recover. I don't go get tested, So you look at all this and someone points out election year. There's another stressor right there, right? That's another stressor. Unfortunately, it shouldn't be. It really shouldn't be. Who you vote for is your business. I don't know why we're making it everyone else's business, but this is causing a lot of problems, guys, to the mental health and the fabric of our society of mental health. And it's scaring me, right? How many of you are not sleeping as well? How many of you are anxious, right? Big deal. So I went back and I talked about the 5 most common stressors that cause any type of problem. Money, work, family, relationships, and economic outlook, all of which we're being hit by. The stress that every single one of us, every one of you out there is stressed right now due to this in some way. Our experience with stress may be different. We may have different symptoms. We may have different support systems. We may have different financial situations, but all of us are impacted, guys, all of us. And yet we're out there tearing each other down. And it's killing me as a person. As somebody that loves to educate, that likes to bring people together, that likes to form a community, I'm watching people tear each other down. Watching this divide everybody. We are all impacted, guys. Every single one of us, regardless where you come from, who you are, what your situation is, all of us are impacted. Money, work, family, relationships, and economic outlook right now. All of us. So let's talk about this article, because some of these stats just absolutely blow my mind. Okay? And you're right, Robert, I agree with you. I believe we'll conquer it as well. That's why this is killing me. We will be okay, but we're not going to be okay in the mental health arena. Our mental health is going down fast, faster than I've ever seen in the history of any epidemic, pandemic. I have never seen the mental health of our society drop faster than I have in the last 4 months, ever, as a physician, ever. I've been in healthcare for a long time, even before I was a doctor, and I have never seen it take such a toll on the mental health of our society. And mental health is what we live for. If you don't feel good, you don't feel secure, you don't feel like life is worth living, you're not going to want to live it anymore, guys. What are we doing to each other? What are we doing? So listen to this. And bear with me. And I'm sorry, I'm very passionate today because this kills me. And I'm not a psychologist, right? I'm considered a primary care. It kills me. And you know what kills me more is I see people come out and say the same thing, and they're taken off social media. And I may be too today. Someone may watch this and say, okay, this girl, she's perpetuating hope. Get her out of here. And fine, do it. I'm perpetuating hope today. Because who can change this? It's us. It's not the government. It's not social media. It's you. You change this. I change this. Friends change it. Families change it. Relationships change it. We change the mental outlook. We decide what we're going to share on social media. We decide what fear we're going to perpetuate. Nobody else has control over that, and we are all contributing. And this is why I don't talk about this much, guys, because I don't want to perpetuate any side. I don't want people to say, I don't want to hear people say negative things to me, right? Nobody does. Okay? What do I think about hydrochloroquine and zinc? All of my patients are on zinc right now, every single one, preventatively. Hydrochloroquine, I haven't had to play with much. Some great success stories there. Some that aren't, but then again, when was it used? It was used when we didn't really know what was going on. You know, like any drug, you could give an antibiotic to one person and they have success. You give an antibiotic to another person and they have a massive allergic reaction that causes more problems. I think it comes down to the doctor being decisive on who uses it and who doesn't. But if it works, it should always be considered as an option between the doctor and the patient. This should have nothing to do with anybody else but the doctor and the patient. There's my thought on hydrochloroquine and zinc, but all of my patients are on zinc. I am taking zinc every single day. Okay? All right, I know you guys are all throwing stuff at me. Thank you for your support. Let me tell you some of this, okay? And maybe you can spread these stats. So, obviously, when we first, thank you, Heidi. I really appreciate it. I hope I do you justice. Clinical mental health therapist, I appreciate it. I am obviously not a clinical mental health therapist, but as a primary care and a human, I'm watching this happen, and it's breaking my heart. And I'm a mom of kids who are also watching this happen. Okay. They did some studies. They've done tons of studies since this entire outbreak has happened, right? China was the first place that they started studying. There was an initial study after the initial stage of COVID outbreak in China, where 53.8% of people surveyed reported that they had significant psychological impact that was moderate to severe from the outbreak, okay? Another study in China, 35% of the people during the COVID outbreak also reported they had general psychological distress. Now, here in America, Kaiser did a study recently. I think it was at the beginning. I don't know. I don't have the exact date out in front of me. 45% reported that their mental health has been negatively impacted due to worry and stress over getting the virus. Okay? Worry and stress over getting the virus. Who perpetuated that? Do you worry and stress over getting any other virus? Ebola killed more than 60% of the people that it impacted. Remember Zika? Did any of you not go outside because you were worried a mosquito was going to bite you and kill you? And for how long, right? That's just over the worry and the stress. That's in your home avoiding people. You're not going to get it in your home avoiding people, right? We know that. So why are we worried and stressed over it, right? Sabrina, getting zinc today. Look for zinc picolinate, okay? All right. China analyzed social media posts pre and post COVID, what people were posting before the COVID epidemic at that time, pandemic now, and after. And they found that negative emotions, anger, anxiety, and depression posts went up after COVID, while the positive, uplifting, and life satisfaction post significantly declined. Rates of anxiety in another China study showed the highest impacted group to be ages 20 to 40. Why? Because we're working, we're losing our jobs, we're growing careers, right? We're raising children. Our lives every day were just turned completely upside down. And we're not talking about that. We're dismissing it. We're promoting it. We're sharing it. We're reading only headlines. Any of you looked at some of those COVID articles, read the headline and not read the article? Any of you scrolled to the very bottom of the article and read the asterisk? I advise you to. Healthcare professionals in China. 50% reported depression, 44.6% reported anxiety, 34% reported insomnia, and I'm going to come back to insomnia and suicide in a minute, and 71% reported distress. I know a lot of nurses, I know a lot of doctors, I know people working in the hospitals. They're working long hours, they're working hard. They're trying to educate and do their job. And a lot of the time, what we're all passing around is actually making it worse. Support for our healthcare professionals. Did you know, I know in Arizona, I don't know about the rest of the area, but did you know that 60% of our healthcare professionals were laid off during the shutdown? 60%. And then they were asked to come back when we had a surge. That's hard. Okay? That's hard, especially. And I'm not working in the hospital. I would, if that was my job, I would be there. No question whatsoever. Absolutely. Not that I'm a primary care. I'm in a private practice, but I have had patients with COVID so far. I have treated COVID. I have watched them go through this process. I have watched the anxiety and the depression far more beat up the patient than the virus. But that is hard. And we're out there instead of sitting there and saying, hey, let's rally behind these healthcare professionals, let's give them options, everyone's just trying to shut everybody down. Well, they're doing it wrong. Well, so-and-so did it wrong. Well, we did it wrong. Well, you're doing it wrong. Well, you need to do this. Well, you need to do that. Well, so-and-so needs to tell us this. Look, people who are treating this are just trying to treat the patients. We're just there trying to be there. And not only are healthcare professionals treating the virus, we're treating the mental fallout from it. We're treating the people that were afraid to go to the hospital that are now having heart attacks and strokes. We're treating people, trying to calm people down so that we can survive and pull together. There is so much more to that. It is emotionally exhausting. It's difficult. And we need to give them all support, okay? Instead of bashing everyone against each other. And when doctors reach out and speak, listen. And you're going to have all sides. You're going to have some that are overwhelmed and say this is the worst thing ever. And you're going to have some that say, look, we have treatments. People are surviving. Don't discount one or the other because it disagrees. Listen to all, okay? Listen to all. There are more doctors out there saying positive things, but you're not seeing it. And you probably won't see this after today either. Whatever. All right. In March 2020, they did an online study to examine anxiety and fear of getting infected amongst dentists. Any dentists out there? How fearful are you to go to work? Should you be? If someone comes to your office with tuberculosis, do you ask? Do you know what I mean? We have infectious disease all the time. All the time. If I gave you guys rates of what people are dying from on a regular basis, you would be like, oh my God, I can never leave my house. Car accidents. Anyway, they did a study on dentists and found that an overwhelming majority of study participants reported anxiety and fear of contagion. Many dentists closed their practices for an indefinite period of time. So not only are they afraid of getting it, they're also afraid they can't run their business and they lose all their money, okay? That is a double whammy. It's one thing to be afraid of getting a disease and using precautions and having to maybe change your life a little bit. Maybe you have to wear more PPE, whatever. But then on top of that, losing your business, many of us have had to completely rework our businesses or close them completely. I know many small business owners that are no longer working, that have lost their livelihood, and they didn't even have an outbreak in their area. And they're scared to death. This is awful. On top of that, those that were already diagnosed with psychological disease, okay, those that already had, schizophrenia, psychiatric disorders, anxiety, depression. First of all, in America, that population of people is likely undertreated or not treated. There's a lot of people, and you see it in the homelessness, that are not getting treated for these disorders, okay? And then you have the ones that are. But let's talk about those people. They did a study on those people and found that the worries about their physical health, anger, impulsivity, and suicidal ideation were significantly higher than in those of us that don't have that underlying condition. We talk so much about the suicide pandemic. Call it an epidemic, fine. I call it a pandemic. People are dying. They are killing themselves. People are killing themselves over the fear of getting this virus. People get a sniffle, they think they have it, and they're hanging themselves. What impact does that have not only on that person and their family, but the children around them watching this happen? How much fear are we perpetuating and spreading to them? Huge increase in call volume and suicide hotlines since the pandemic. I don't even have a number. There were so many. Sales of alcoholic beverages in the United States, want to take a guess? Since the pandemic, rose 55% in the week ending in March 21st compared to the same period last year. Online alcohol sales have jumped 243%. 243%. Isn't alcoholism already a major issue? What about the opioid epidemic, guys? What about this? Before we went into COVID, we were talking about the opioid epidemic. We were talking about people dying from prescription drugs, heroin. We were talking about suicide rates. We had 1-800 suicide awareness hotlines popping up all over the place. Where are those now? Where are they? Shoved under the rug while we sit here and talk about the 1 to 2%, and in some populations over 70, okay, up to 10%, still a 90% survival rate and continuing to improve, I want to add. Every month that goes on, more and more people are surviving. Death rates are getting less and less. Hospitalizations are getting less and less. We are actually doing something with the virus. We're not there yet, okay? We still have a long way to go. This isn't going away, but we're making progress in that. But what we're not making progress in is the mental health of our society right now. We are not making progress in that. We are failing hardcore, and we're doing it. Right? Alcoholism is up. Drug abuse is up. Suicide is up. depression is up, anxiety is up, insomnia is up, okay? There was there were many cases, and I don't know if you guys heard about these. Probably not. Let me find it. Where did it go? So, there was a list of people that committed suicide. I had different examples. But they were, well, let me tell you this first. A recent study in China indicated that 96.2% of those that actually recovered from COVID had post-traumatic stress syndrome. Okay, so let's talk about those of you out there, which there are, what, 4 million of you, I don't know, that have survived COVID. 3 million have survived COVID. Let's talk to you guys. Where are you guys? Come out. Help us out. Are you okay? You've survived. Tell us your experience. Tell us how the emotional anguish impacted you. I have people all the time, patients all the time that reach out saying, I have a sniffle, I think I have COVID, and it is a good 4 or 5 days of severe panic attacks. Right? 96% in China post-traumatic stress syndrome after surviving it. And these are mild cases. These aren't even people that were hospitalized or almost lost their life. These are just people, okay? Right? Now, around 50% of the recovered patients remained anxious during the 2003 SARS epidemic. Okay, so same coronavirus, honestly higher death rate. SARS, wasn't that at 10%? Some 8% death rate through the entire thing. And only 50% of them had post-traumatic stress over it. But with this outbreak, 96%. What's the difference? I ask. Have any of my patients gotten it again? So far, no. But they will. I mean, it's a coronavirus. It comes and goes. But I can tell you they're all fine. None were hospitalized so far. Everything's been fine. But they're all, they all take very good care of their stress. They all are highly, my patient database focuses a lot on nutrition, right? And I'm sure I'll have one at some point that'll have a more severe presentation. I expect it. Because that's the odds. I mean, I expect that with cardiovascular disease. I expect that with cancer. I send how many people per year for a mammogram? What percentage of them come back with breast cancer? It's always going to happen, right? Always. It's always going to happen. As a physician, this happens. So as a physician, I think I have a better light on it than many of you because I say, well, out of 100 people I send out, I'm going to get 1 or 2 that aren't going to be so successful, right? And that's with any medical condition, particularly the top, 10. I mean, my grandfather who just passed 2 weeks ago died of pneumonia. Not COVID, but pneumonia. Pneumonia could be from anything. Could have been from anything. All I know, it was a non-COVID pneumonia. That's all I know. They didn't ever find out what bug it was, right? People don't test for that. People don't test for the flu. Right? Anyway. So the people who are actually surviving COVID are also having psychological decline. Now, to me, I would think, okay, I had it, I survived, I'm doing well, I shouldn't be afraid of it. And even though they did well, they didn't list it as COVID, but they went as close as they could without, right? Because he was in a assisted living home, and he had been declining for 1.5 years. He had been on hospice for 1.5 years. This was not a healthy man, okay? Why should we all test for the flu? I don't think we should. I think if you're well and there's no need for you to go to the doctor and spread it to somebody else, don't. I mean, I rarely advise my patients to test for the flu unless they're really in a situation where I'm like, okay, whoa, you're serious. We need to find out what this is. Most of the time I'm like, please don't go to the doctor. Stay home. You're sick. Right? I had a family member during H1N1 that almost lost her life. She was, I don't know if she almost lost it, but she was very, very sick. Very sick. And let's see, how long ago was that? 9 years ago? So she was in her 30s. This isn't new. But what's new is not the virus. It's not the pandemic. It's not the situation we're all dealing with. It's the stress that we're putting on ourselves surrounding it. Anyway, social isolation contributes to the pathophysiological, this is from a study, Social isolation contributes to the pathophysiology and psychiatric disorders and suicidal behavior. There's a book on suicide by Durkheim that emphasized the social connectedness is a critical factor in emotional health and social stability. Anxiety and fear of contagion of coronavirus may be related to uncertainty, fear of an unknown, and panic-induced stories in the traditional and social media. Listen to this, guys, repeated exposure to reports about the COVID crisis can intensify the anxiety. Okay? Repeated exposure. Open up your Facebook feed when you're done with this and tell me, how many times do you see a post about COVID in one scroll? Repeated exposure worsens the anxiety and the fear. This is why I don't talk about this much, because then what am I doing? I'm contributing to another darn post about this, but I finally have to speak up because I am watching people slowly fall into a hole that will ultimately possibly end up in their death, absence of any infection. And I refuse to let the public do this to ourselves. Okay? I told you I'd come back to insomnia. And we think about insomnia with stress, right? Back to the 5 top stressors that are all impacted by this pandemic. Insomnia. Bidirectional. It has been proven that relationships between insomnia, depression, and anxiety are all bidirectional. So, if you're depressed, you will ultimately have insomnia. If you have insomnia, you will ultimately have depression. If you have anxiety, same thing. You'll ultimately have depression or insomnia, right? All of these go together. And proven that those with insomnia, sleep is a standalone risk factor for suicidal behavior. If you're not sleeping well, it results in suicide. That's been proven. And yet anxiety, depression, and insomnia, right? What causes that? Stress. What are we doing? We're putting stress on ourselves, our loved ones, the people around us, the people that are supposed to be friends. All of us, we're a community, guys. And we're killing each other. Blame everyone you want. Go ahead. Blame powers that be, blame the government, blame so-and-so. It doesn't matter. It's us, the people, who are spreading more and more. Why does the media keep writing about it? Why is the media focusing on misleading headlines? And when you open the article, it doesn't even talk about what the headline said, right? Yet I'm watching educated people that spread the story because the headline triggers something and they don't even read the article. The article doesn't even talk about what the headline talks about, or it clarifies it. And you're like, oh, okay, that's fake, right? The government's not doing that. And to be honest, the media is doing it, they're publishing it, but we're buying into it. And we're killing each other. Suicide rates has steadily grown before this by many percentages per year. Like I said, before the pandemic, all we heard about was suicide awareness, call suicide, opioid epidemic. People are dying, people are killing themselves, we're losing people to drugs, alcoholism, all this type of thing. And here we are making it worse. I do want to talk to you about what you can do and things that you can do. But I have so many questions coming through. Give me a moment. Let me see. I think most of these I've addressed, but a lot of you are sharing stories. And like I said earlier, the people that have gone through COVID, please come out and share your positive story. Your positive story. Okay? I read one yesterday. People, it's taking 3 or 4 weeks to recover. They're not back to normal after 3 to 4 weeks. And they were implying that there were like permanent deficits in the majority of the cases. I think they said like 35%. I read the article and they said they weren't back to their normal like activity and for 3 weeks, and because they were tired. Now I found that too. I have a patient who just recovered from COVID, took her about 3 weeks till she felt normal. Now I've had a flu that's done that too. I had a flu many Christmases ago, about 10 years ago, and I couldn't even make it down the stairs. It was a good 14 days before I even got out of bed. And then I had a good 2 or 3 days of fatigue, or 2 or 3 weeks of fatigue after that. I still wasn't quite back to normal, but I was fine. So, I mean, when you read the article, it actually talks about fatigue as the lingering symptom, not neurological deficit, not follow-up strokes. Those happen. Don't get me wrong. Once again, there's always a percentage of the population. If I send 100 people out for a mammogram, odds are 2 of them are going to come back positive for breast cancer. It's inevitable, right? So just keep that in mind. Have they finally determined if you can get it again? You know, Robert, corona in general is a reinfective virus. I mean, I have no doubt you can get it again. I mean, coronavirus is one of the common colds. Did you know that? Not necessarily COVID-19, but there's a whole family of coronaviruses. These aren't new. They've been around forever. You've probably had the coronavirus cold multiple times. Now, whether or not this one is one you can get multiple times or not, I don't think they know yet. And to be honest, it's way too soon to tell. So why are we making any speculations? Why aren't we just focusing on the people that are recovering, the progressions that we're making in recovery, the progressions that we're making as a whole? Why did we shut down? We shut down so we could learn more. We didn't shut down to stop it. We shut down so that we could be like, whoa, okay, what works, what doesn't? What can we do research on? How can we figure out? How can we take a slower flow of patients so that we can kind of figure out what works, who's going to survive, who's not, right? After New York and New Jersey were devastated, right? That's why we shut down. So we're making advancements and nobody's paying any attention to that. No one's watching. We get reported. Dozo, new deaths, so many new cases. Okay, but how many survived? Sorry. But yes, I believe you're going to be able to get it over and over again. But I think it'll get milder as it goes on because that's the way this works. You get partial immunities, you get stronger immunities. Every year you can get the flu. And let's say away from flu shot, which last year was 30% effective. So 100%, so if 100 people got the flu shot last year, 70% still got the flu or could have gotten the flu. You could walk into a room with 100 people. One person has the flu, right? And only 2 people walk away with the flu, but they expose themselves to all of it. Why? I mean, the flu's reinfected every year. The host matters. I think corona is very similar. I don't think everybody in the room is going to get corona when one person is affected. I haven't seen the data for that. Someone has the data for that, by all means, share it. Okay? Minnesota is doing a lot for mental health. Yeah, Kathy, I hear you, but I think a lot of the mental health that we're experiencing, they're doing a lot for the mental health, the clinically mentally ill, which I think is great because we talked about that. They're feeling more. And maybe there's a lot more help out there that I'm not aware of for a lot of us that are just trying to manage running a business, teaching our children at home, not with underlying mental disorders, but are now developing them. That's what I worry about. A COVID-19 comedy hour to loosen everyone up. Bill, I think a comic did that. I can't remember who. I want to say it was Dave Chappelle. I don't know. I'll go back and look. Heidi, we have a 4-year-old husband waiting for kidney transplant, and I work in mental health. All we can do is practical mindfulness, living in the moment, and train our brain to find what's good and what we can control. Gratitude. Absolutely. Gratitude is being missed right now. Media RIP 99.96 is all we need to know. Yeah, I mean, we're not looking at that. And granted, there's, of the high risk group, I think there's, they range it like 50 and up. Okay. But 75% of those deaths are 70 and up. So they really should break that down further, in my opinion. They should break it down in the 50 to 70 for sure, if not 50 to 60 and 60 to 70, because I think it will ease a lot of people's minds. However, if you lump in 50 and up, there's still a 90% chance that it will be very mild. So, although I still think it's lower than that. I still think you have a better chance than that. I just think the data is kind of being skewed. I'd like to see them break it down further. Almost died from pleurisy in 2017. Right. Pleurisy kills people. Right. A lot of you are saying keep going. I'm kind of exhausted now. Turn off the media for 10 days and see how you feel. I agree with you, Bill. And if I didn't want to be here for all of you every day, I wouldn't get on social media, but I want to be here for all of you as an inspiration and hope for ways that you can improve your life. I'm making a commitment to my audience to be here. The rest of the day, I try to stay off social. Interesting. Okay, there we go. I had a poor connection on Instagram. I thought maybe they cut me off, which is possible. I worked in nursing during SARS or MRSA, can't remember which, in 95, 96, when people were put in isolation room. They didn't react like they were doing this. It's saying, yeah, you know what? MRSA is a great example. There's no cure for MRSA. We don't talk about MRSA. To be honest, we didn't even talk about SARS, and that had a way higher death rate. Do you think we should open everything up and just wear PPE? I do. Well, Robert, we're pretty much open here in Arizona. I mean, we have, I think bars and gyms are closed, and the gyms drives me nuts because you can definitely take precaution to wipe everything down. But I also have the experience of knowing people who are surgeons, doctors, nurses, who are all getting it regardless of wearing PPE. You know? So, no, I think PPE can carry it as well, just like any other hard surface. I think that if you're not using the PPE correctly, you could be causing more harm than good. But that's my personal opinion. People need to do what they feel safe. I am not making this political. If you feel safer wearing a mask, wear a mask. If you feel safer wearing gloves, wear gloves. You got to do what you got to do. I'm not a high-risk person. So my opinion on that really doesn't matter to the high-risk person. The high-risk person has to decide. But I will tell you that doctors and nurses are one of the highest infects, you know, along with assisted living facilities where they're all wearing PPE. Okay, so I don't see a direct correlation. I think more people are staying home when they feel sick. I think that's helping. I think people need to stay home when they feel sick. That I do. When you have a sniffle or a cold, just take a few extra precautions. It might not be allergies. Why don't you get tested and find out, you know? Many insurances have waived fees for approved telehealth. Yeah. Richard, I just kind of talked about the mask. So, I mean, I watch people all day long. And then they crumple it up and they throw it in their glove box, or they put it in a bag, the same bag every single day, and they put it next. But all those people, they just walk by, just breathed on it. So I don't know, you know, unless you're changing a mask. I'll tell you what, if I was doing surgery in the hospital, I would not wear the same mask every day, patient to patient. I honestly think you're trying to push everyone to be unhealthy. Yeah, I can't, Bill, I'm not going to get into politics on this one, but I do appreciate your opinion. I really do. It's not where I want to talk about it. You're passionate educator. You're welcome. Okay. Well, guys, I think I've probably exhausted you guys. Let me give you 5 or a few tips on what you can do to shut this out. Number 1, I'm switching my order. Turn off social media news. Turn it off. Take a vacation. Spend time with your family. Do something you love. Talk to your friends. Reach out to people. Practice self-care. You can reframe this situation. Like I said in another live, Ivory, give me a minute. I'll come back to that. Like I said in another live, you have a choice. You can spend all day worrying about the 1% to 2%, or you can spend more time thinking about the 98%, or you can remove yourself from it completely and just do what's right for you and your family and worry about you. Protect yourself. Put up your boundaries. Take care of yourself and quit judging other people for what they want to do or what they don't want to do. Because that's perpetuating fear, divide, and more anger. And that's not helping. You know? Like I said, I'm a low-risk person. I can't speak to a 75-year-old man with diabetes who's a smoker. I can't speak to that person. I imagine that if I were 75 years old and I was a smoker, I probably would wear a mask and not want to leave my house very much. I probably would protect myself more, right? And that's what they need to do for their own health. So quit worrying about what other people are doing. Quit worrying about spreading the fear. Quit hitting share on news stories that talk about the devastation. Click share on the news stories that talk about the 98, 99% that are surviving, that are making it, that are okay. Otherwise, I want to see an article put out by the media, here's my suggestion, that compares all of the infectious diseases we've gone through in the last 10 years, death rates, numbers, cases, complications, age ranges of death. I want to see it all together. Because all of these viruses are awful in certain populations, all of them. Like I said, Ebola was 60%. You got Ebola, you were a goner. Anyone survive Ebola? Anyone out there? No, probably not. Without significant, someone brought up, I was talking to my stepdad the other day because he is 84. And I asked him about polio. I said, did anyone actually come out of polio without a deformity? And how long did that vaccine last? Did they shut things down? I don't know. I have to go back and look at that. We've gone through this before, guys, and we've always come through. We've always pulled together and come through. As a nation, as a world, we've always come together and pulled through. And yet here we are destroying each other over another situation that we've already gone through. Don't do it. Don't buy into it, please. What do I think of the Frontline Doctors video? Ivory, I was fortunate enough to watch that yesterday before they censored it. What angers me the most, and this probably played into why I'm talking about this today, to be honest, that video, is the fact that it was censored. And probably none of you saw it. And that breaks my heart. Because how can you make an educated choice if you don't see both sides? I just said, from all these studies in China, fear, uncertainty, instability leads to suicide, depression, anxiety, and insomnia. Yet we're giving uncertainty because we're not allowing people to look at both sides. We're not allowing people to use your brain. You guys are all smart. Read two sides, pick what you believe, and move forward. But you're not allowed to see it all. And that was taken down. I don't even think that was up for 24 hours. And it's a bummer. And by the way, for any of you that missed it, they were talking about the advancements and that they were actually curing people of COVID, and they were mad. The article from the media this morning said the so-called doctors said that people are recovering. I don't know if any of you doctors are out there, but I'd be pretty pissed if someone called me a so-called doctor. There's my opinion. Okay? Hand sanitizer is selling out, but we can focus on your nutrition, mental health, and exactly, and I know I've talked to you guys about my program, about nutrition, but that's why I'm here. I'm here to educate you that nutrition does matter. And if we could go into these patient populations and actually assess their levels of, we have you guys heard about this? I'm going to talk more about this on Friday. I actually have a really cool COVID research study to discuss with you on Friday. It's pretty freaking phenomenal. You guys have to be here Friday, okay? Check it out. But there are tons of articles on low glutathione being linked to worsening COVID symptoms, low zinc. Zinc actually blocks the replication of coronavirus. That has been proven in research. It's why everyone's giving it. Arizona hospitals are giving zinc when you're administered. Why? I know Texas is as well. Why? Because it matters. Have you guys heard about it? Vitamin C. Can't talk about that one. My video will get pulled down right away. There are tons of advancements in research on treatment. None of you are hearing about it. That's why you're scared. That's why you're fearful. Don't buy in. Okay? Practice self-care. I gotta get going. I could go on all day. Practice self-care, reframe your situation, look at the good, find the good in the people around you. Don't bring each other down. Come together. Can't say that enough, particularly for our children. Please come together for our children. Number 2, do not isolate yourself. Reach out. Now, if you're a high-risk person, you feel safer being home, great, do it. But don't isolate yourself. Call people, talk to people. Remember that interaction plays a role in anxiety, depression, and suicide. Please, please talk to each other. Who cares if you disagree? Talk. Communicate. We've all disagreed on politics in the past, all of us. I remember when I was a kid, my parents would have a party, they'd all drink, they'd eat dinner, and they'd, talk about who they were, who was going to be the best for the election. But did they leave defriending each other? No, they didn't. They had a conversation, they connected. Connect with each other, learn from each other. Maybe we'll actually get somewhere. Write, speak. Write down your fears. Talk about them with friends. Avoid social media. Avoid those types of stories. Hit block. Not because you want to block the person that shared it, okay? That's not what I'm talking about. Block the posts like this. I don't want to see posts like this. You can do that on social media. Doesn't block the person. You love the person, right? They're your friend. Not talking about the person. Block the type of post. I don't want to see any more posts about COVID, right? Lastly, guys, if you're depressed, anxious, contemplating your life, please get help, please. I love you all. I'll be here tomorrow. Have a great day.